Good afternoon. Today's July 31st, Friday, the end of July, as we move into August tomorrow. I'm Terry Scoggin, the CEO of Titus Regional Medical Center, and welcome to the weekly COVID-19 update. Large storms through the area this morning, so it was good to see the rain on the ground and the cool air. It'll be a little hot this weekend, so we appreciate it. I'd like to thank you people for joining. Ruth, glad you're joining us today to see you there. Miss Tonda up in the PD clinic, thank you for joining us as well. I'd like to get started this week and talking about just community spread. We're continuing to see the community spread throughout the month of July. May, we saw a little targeted impact in Northeast Texas and Mount Pleasant. In June, we were down. But in July, it's been community spread for Northeast Texas, consistent with Dallas, Austin, the rest of Texas. We've seen about 100 positives every week in July, and we're anticipating that this week as well. Over 250 tests a week is what we're seeing for almost every week in July, and this week is no different. So a little bit down this week. We were averaging 12 in the hospital last week. This week we've been averaging between 5 and 6. This morning we have 7 people in the hospital. So from a community spread standpoint, we're continuing to see it. We have seen some outbreaks in some nursing homes in the area over the last week or so, which is impacting the numbers. But we've said from the beginning, our corporate partners across Northeast Texas did a phenomenal job in the industrial agricultural area. We were 8 to 9 weeks behind the rest of the nation in that spread. And the same thing for nursing homes. They've done a great job for 4 months now, since March, of mitigating that spread. It's very difficult with a community spread for them to do that. So our prayers continue to go to those in the nursing home and their families and the workers who are working very hard outside the health system this week to accomplish that. From a number standpoint, I'd like to just give an update. As of this morning, Titus Regional Medical Center, our mobile testing, and our medical staff partners have tested over 5,800 people of all counties. 4,210 negative. We've seen 1,391 rounded to 1,400 positives, with 196 pending through today. The rate this week's a little bit down on the 7-day spread. We watched that. We've been in the high 20s and 30s over the last few weeks. I saw an article last night in the Governor. The target is get the 7-day community spread below 10%. We're double that still. So it's still something to take into consideration and to watch for. And just please remember, continue to wear your mask, to sanitize, use the disinfectant, social distance ourselves to the best of our ability. So we appreciate our retailers in the area. Over the last week and 2 weeks, we've seen a ton of local businesses and local industries really enforcing the mask policy and working with us on that one. So we truly appreciate that effort. Every little bit helps. I know it's tough sometimes to wear the mask, but anything we can do, appreciate it. I get a lot of questions over the last few weeks about the Wellness Center at Titus Regional Medical Center. It's been tough with a gymnasium in the hospital and in the medical plaza where we have cardiovascular patients, OBGYN patients, surgery patients. To have a gym in that is a little concerning during this pandemic and crisis. So we did take in the beginning and closed our gym, the Titus Fit Wellness Center. We are starting to opening that up, and we're starting to look towards that. Our goal will be opening the Wellness Center or the gym on Monday, August 17th. We will follow the guidelines set up by Open Texas from the governor, but just for the record and what we're working towards now, even with a continued spread or a continued increase, we are going to open the gym on August 17th with the precautions needed to protect not only the visitors, the staff, the patients in the building, but August 17th is a day. And I know I appreciate the patience from all the members in the local community. I know it's been frustrating to not have the Wellness Center open, but we will be ready to go on Monday, August 17th. We look forward to you joining us as we work out, we walk, and we swim in August. I want to thank our partners in the newspaper business over the past couple days. We had the pleasure of sitting down with one of the editors and writers yesterday, the Mount Pleasant Tribune, and a couple of local papers that they work for. Just talk about COVID in the area. Not only Titus Regional, but what we're seeing in Northeast Texas. We appreciate our local media and how they've worked with us since March on getting the message out. So thank you to them. Today, I just want to talk a little bit about my role. I'm blessed. I've been really blessed to serve to live in Mount Pleasant since 2004, but to serve as CEO for the last 3 years. And I have different roles. I've been coming to you for several months as the CEO. And that's what my badge says, and that's what my dot says here. But I serve several different roles. Not only do I serve as CEO, I serve as a brother to my Jerry and Sherry. I serve as a husband to Angela. I serve as a father to Joshua, Rocky, and Luke, Matthew, if Angela's listening today. A father-in-law to Anissa, and as a son to my parents, Betty and Jerry. Last week, during a little emotional, but it's cool. Last week during our Facebook Live, we had to cut off immediately. I will tell you, my father, Jerry Scoggin, you see in the picture here, was tested COVID positive last week. And during our Facebook Live last week, Mom called and we had to admit him to the hospital with pneumonia. And in the process of our EMS moving him over, his test results came back that were taken earlier in the week that he was positive. So we went through that last Friday afternoon, my mom and my brother and sister, my dad being COVID positive and being admitted to the hospital. I'm going to tell you, I was blown away. I want to appreciate the nurses, the clinical staff, the EVS, the nutrition, the doctors, the nurse practitioners, the imaging team that worked with my father over his days here in our hospital as a COVID-19 patient. It is tough. He was isolated. He's in a room, people wearing masks. We have announcements that go over the overhead of when we move a COVID patient of alarms. It was tough for me and my mom to sit in my office, a different part of the hospital, and listen to the code 19 of my father moving from the ER to the imaging and up to the third floor. And we knew it was him because we knew the process was going. We followed the guidelines. We didn't see my father while he was in the hospital. And since he was a COVID patient, we did have to, could not go to visitation. But we did see him from a distance when he entered the hospital from EMS and we left the hospital on Wednesday. But my father was discharged on Wednesday. I truly appreciate everybody in this community who's reached out and prayed for my mother and my father over this time. But I've had the opportunity now to serve in the role as a son of a person who had COVID-19 and watch my dad. And for an 81-year-old with Alzheimer's and dementia and pneumonia last week, COVID was a piece of cake for him, and nurses were able to nurse him back to health. He was out of it for 4 or 5 days. They did nutrition and medicine to get him back, and he's back at the nursing home. And I appreciate our friends at the nursing home who are taking care of him. But COVID is tough, and for the people who say it's not real or we're making it up, you know, guys, this is real, and it impacts all of us. And that's what makes my role in this community so special. Mount Pleasant, Titus County, Northeast Texas is a special place to live. And for the caring that happened for my parents last week and my family, on the behalf of my family, I want to say thank you for everything you've done and for the prayers. God bless to each of you. Good luck this week. Please stay safe, and we'll see you next week for our COVID update.